Hi everyone, I'm Dr. Brian Jaros. I'm coming to you live here from ACR 2025 in Chicago. Today I'll be talking to you about two abstracts regarding the sinonasal or ENT components of ANCA-Associated vasculitis. For those of us that treat ANCA vasculitis, we know intimately there's a lot of challenges surrounding how we can best approach these patients and get them into clinical remission. Immunosuppression itself is not always effective alone for these patients, and we heard earlier today actually in a session from Dr. Lally and Dr. Zacharak that we really need to partner with our ENT colleagues in order to best treat these patients. So what new data do we have this year about the ENT manifestations in ANCA vasculitis? The first is from abstract 0712. This is a study of the nasal microbiome in these ANCA vasculitis patients. We know that the microbiome in these folks is altered, and there's already been data, for example, that colonization with staph bacteria seems to be a risk factor for relapses in these patients. A group took this a step further. They isolated a bacterial supernatant of two different bacterial strains and then took nasal epithelial cells, some from ANCA-associated vasculitis patients and some from healthy controls, 3 patients in each group. They then exposed these nasal epithelial cells to the bacterial supernatant to evaluate a response using transcriptomics. And what they found is interesting. The ANCA-associated patients had a different transcriptional response with certain genes being upregulated, including those in angiogenesis, so blood vessel formation, as well as in the extracellular matrix modification and in cell cycle pathways. As you might imagine, based on the pathophysiology of ANCA vasculitis, there were several genes upregulated that contribute to neutrophil biology. And perhaps most interesting in these ANCA vasculitis patients, genes associated with barrier formation, mucin function, immune signaling were all downregulated in patients with ANCA vasculitis. So the authors sort of concluded that there's something to do with an impaired cell signaling pathway, impaired immune defense strategy in these ANCA patients. They're responding differently to these normal bacteria that all of us are typically exposed to on a regular basis, and that aberrant response is contributing to the inflammatory environment in the ear, nose, and throat. Now, another group took a more clinical stab at this. This is abstract 0725, Rhee et al. They noted that having ENT manifestations in ANCA vasculitis is known to be associated with an increased risk of relapse. And that group has previously come out with an aptly named patient questionnaire called SNOT-22 that the patient fills out in a variety of different domains to kind of understand their burden of psychologic and ear, nose, throat symptoms. They used this questionnaire adding 4 additional vasculitic components surrounding crusting, bleeding, and nasal pain, and looked for an association of items on the SNOT-22 plus with different clinical manifestations. So they had a huge group of ANCA patients. This was 663 patients, a majority of which had a history of sinonasal disease. The authors found that a higher total SNOT-22 plus score was more associated with active vasculitis. And even when they looked at the different subdomains within that SNOT-22 plus score, including things like vasculitic manifestations, sleep quality, psychiatric qualities, facial symptoms, nasal symptoms, all if they had higher scores, were more associated with active vasculitis. When they looked which specific features correlated the best with active disease, it appeared to be the presence of severe nasal pain, actually the presence of self-reported sadness, and a decreased prevalence of sneezing. Now, they also compared these to healthy controls, and even in, quote, inactive vasculitic disease, those folks tended to have higher scores than their healthy control counterparts. So both of these studies give insights into the ENT manifestations of ANCA vasculitis, one from the biologic aspect, helping us understand the mechanisms of this disease, another from the patient aspect, helping us understand our treatments and the patient-reported outcomes, and both coming together to really enrich our full understanding of how we should approach these patients. That's all I have for today. Take care.